Hello, everyone, and thank you very much for the invitation. It's a pleasure for me to join today's program. And I feel probably I'm the only Asian today in the in the whole classroom. And also I'm probably the only outlier because I'm not really from a medical background. But I really want to bring to the table my knowledge a little bit about from Asia, from my business knowledge, if anything can be contributing to today's topic. You can see my slides, no? Okay, let me
Yes,
continue.
you can. And let me just give the chance
Yes.
to say that you're a nation Catalan. So it's good to have you here.
Thank you, Monte. So as Monte was introducing me earlier, I was, before COVID, I was 10 years working for Axio based in China. So obviously we work with many different sectors, but I have to say health and tech sectors are the two that I worked most, and I really enjoyed working in these two sectors. Since COVID, I moved here to Barcelona, so probably doing similar stuff, but from a different perspective. So this is a little bit of my background. I share a little bit of my previous business photos. This one when we working on the Mobile Congress Spanish mission in China, we went to visit Alibaba. The upper one is when 2018, our President Xi Jinping visited the state visit to Spain, and he and Pedro Sanchez were witnessing the 18 MOU. There was one of the, this is the very particular one signed between the hospital clinic, Dr. Campisto here, with one of our business contacts in Guangzhou in China. They were at that time discussing an innovation project. I quickly want to talk a bit about this because this is a typical thing, not really regarding today our ATMP. It's more about when it comes to a project, sometimes in this case, the government contributes a piece of land and a PE of Chinese PE contributes a capital, while on the other hand, from Spain, from Catalonia, Hospital Clinic was about to contribute to the software, our talents and know-how to this project. I'm just saying, taking this for example, like for the future collaboration to have some inspiration. This was 2019 when we had this mission from Spain. I think it's from Catalonia. CAT Salud, BioCat, among with different other biotech startups were visiting, and there's this big exhibition Pharma China. And this was 2023 when the Chinese ambassador in Spain was visiting Barcelona. And his team was asking me, I'm coming to Barcelona. Do you have anyone to present to the ambassador that like we can have some big potente Catalan company? And I was like, okay, how about Glyphos? Because I knew that year Glyphos was celebrating 40 years anniversary in China market. And none of the party knows this occasion could be interesting for both. So I think it would be nice to connect the dots. And they were here in Barcelona visiting, excuse me, Senor Grifos, had a nice handshake because also that year was, if I remember right, 2023 was the year between China and Spain signed I think it was a celebration of 50th anniversary of diplomatic relationship. Also that year I moved to Barcelona. So these are few photos of my little background in this sector, working with the people here. I prepared 2 slides here because I thought I need to have a little bit, because the topic Monte gave me is what Europe can learn from China. But honestly, I think it's a bit too condescending to say what we are to teach Europe, because you guys have so historically strong assets here. But I also feel these slides I prepared here is probably not necessary because all the previous speakers already spoke about, you know, how difficult, how bureaucratic to work in public sector. I myself come from a public sector before. So I felt if I don't even need to mention this again, that you all know clearly the question. And I just hope if I can bring anything new to this conversation, and that is, we have already know this is the problem, and how can we do it better? or how can we do it differently? In Europe, we might have a lot of limits, and probably in this sector alone, because of it's a public sector, many institutions might get involved. So it's not easy. And let's face it, it's not easy in China or many countries in Asia as well. It's just to different degrees, and how we can see a bit different stories. Maybe we can have a little bit inspiration. And if that's something can be helpful, I'm happy. So I wanted to start with a very small story here. I promise I'll be very quick. Alibaba 2016, exactly 10 years ago, May this month, as they come to us, because I was based in Shanghai, and they say, look, we wanted to come to Spain and we really like this market. We want to talk to the Spanish companies and to make their products available in our e-commerce platform. Even that time, people already know Jack Ma. Alibaba was already public in the States. So it's no introduction. Everyone knows this company. However, because I work for a public sector company, it is normal because this is not usually the clients they're serving. If we have any foreign companies, in this case, Chinese company, please come to Catalonia, invest your money, hire our people. That is their objective. And to help them really for their business is not really their objective. We need to help the Catalan business. So this is very logical. When it came to this request to us, I just feel I cannot really help because my hands are tied. But I feel it because it's not just to help this Chinese company to put some Spanish company Catalan products in their e-commerce platform. We are actually helping those companies to sell to China. And we know that later what happened in this story because their e-commerce and the China market was so booming in the past 10 years. So if we on the surface, we just cannot do because it is not really our KPI. What I did at that time was I talked to my boss saying, okay, I know we are not supposed to do this, but if let's say, if I can persuade other people to do this together, other organizations to do this together, can we possibly still, come back to this? And then my boss said, okay, maybe, you try, because I really cannot help you from here. So I was in Shanghai. I pick up a phone, talk to my contacts in Ayuntamiento, Barcelona City Hall, and I gave another call to the Barcelona port. So I told them, it's honestly now thinking it's a white light, like a Mentira Piadosa, no? Because I didn't say we already agreed to do this. We say we have the interest, but we'd love to have your collaboration. So would you be interested to be on board? And luckily, both of them say yes. And then I said to the Port of Barcelona, okay, if we are going to do this, I don't want to do it in a anonymous, even if it's 5-star hotel meeting room. I want to do it in your World Trade Center with a nice vision to the sea, where we can see the cruises coming to the Barcelona. This is their landmark. This is where we need to impress the Alibaba group. And they agreed. So it was a little bit lobbying, let's say, but luckily I pulled the strings to make these 3 organizations, Axio, Barcelona City Hall, and Barcelona Port, to work together and talk to respectively all 3 of them, their network of the Spanish Catalan startups or any other companies, BMAX or bigger companies, to come to this meeting to know what is Alibaba, what is e-commerce, even though they do not yet willing to hire anyone here or spend anything in terms of the greenfield investment. But luckily from that time, we had 220 companies came to that event. And what happened was, probably some of you knows, especially some cosmetic products, chemical products like Yixing, Madidem, gained big success in China simply because that they have this new channel online. Madidem at that time told me, look, we had only before 1 production line. Because we now sell to Alibaba from their platform, we need to create a 2nd line just to double our revenue. So I know this is a bit long story, but I wanted to let you know. And I think earlier, Dr. Ramon, I think, no, Dr. Jorge was mentioning, it's not easy to work in a public sector, but it's not undoable. Sometimes if we can try a little bit, I think the idea, I hope it can be inspirational that we can still do something, maneuver something. Okay, let me continue with my presentation here, because earlier when I thought, okay, I need to see what we can really bring to this table, I thought about 4 different countries in Asia, not only mine from China. So I picked the 4 cases, and also there are different examples here. So I picked Japan, their drug approval fast track system. And Singapore, they have a trust architecture. The South Korea, they have this data, health care data system. And China, I want to mention a little bit of this RWE pilot zone. The idea is to say it's all different system. Even in Asia, we are all different. Even we look very similar, the culture, we are very different system. But there are certain same principles. It can be transferable. So Japan, for example, we talk about this Sakigake pathway, and people in this sector, you probably know even more than me. Basically, it's a fast track to get drugs approved. It can be compressed at the target review time to 6 months. However, it's just a conditional access, meaning after that, they still need to give this further review and to still come back if this post-market real-world evidence is solid enough, or they might sometimes withdraw this approval. So this is an example of Japan, how they wanted to expedite certain process when it comes to its necessity. And they have this criteria very clearly. It has to be super innovative, super prominently effective, and it has this first in Japan, or simultaneously, it is applying in EU or in US market. So these are the 3 criteria. They all must be met so to qualify this Sakigake pathway. So when we see this kind of example, it has to be very clear indicators. And let's see the date. Not to mention, this is already an initiative launched almost 10 years ago. So let's just look at different hour for us as well. I'm Chinese, looking at our neighbors, what they are doing. Sometimes we are probably also giving, taking their references. So this is a brief photo here. I will leave this presentation later to you guys so that you all have this information. Singapore has this health data. Let's talk a bit about health data. Singapore has this so-called SG10K health because it has this program. Even let's say Singapore is so small, it has only, I think their population is probably smaller than Catalonia, if I'm not wrong, 6 million, something like that. But they wanted to launch this one. Let's look at the time, almost also 10 years ago, because you know what? Although it's a small country, they have 3 major ethnic groups. And traditionally speaking, Asian as in the whole worldwide ethnic groups is not really represented enough. Correct me because I'm not the expert, but that's the whole initiative. Why behind this? They wanted to do this. By keeping this database, they do this data with the volunteers, and nowadays, I think the latest number is 10,000 volunteers included in this SG10K Health, as they're still evolving this program, making it for all these purposes. It's all of Singapore coordinated approach for precision medicine, and also to understand how to make the data useful when it comes to ethnic consideration, which is quite important, even though it's a small region. Now we take a look about South Korea. They have this My Health Way. This is the app. Individually, Koreans, each one on their mobile phones, they can have this like a digital hub. They launched this in 2023. Basically, every patient, they consent to have all their data. And now the data is including 113 data items across 12 categories. And they are sharing this across different hospitals, different public agencies into just one single digital tab. And what's the implication here? I think not only for the patients that it's much easier, and when they come to mobile one from one institution to the other, when it's for their personal need, but also it has the inspiration, I think, for Europe as well, because historically speaking, if one patient, imagine he has some rare disease, you can have all this history tracked and not just to be tracked in different institutions or hospitals. This is, I think, one inspiration. Look at this, My Health Way. This data is available, and I think earlier another speaker mentioned this, and I cannot agree more, although I'm not the expert. European, we have this GPDR, but on the other hand, it's great to provide the privacy for individuals because we care about this in Europe. I totally get that. But on the other hand, we cannot deny sometimes it impacts the real data, especially real world data's aggregation and some certain other data. But we have to admit, maybe there is another way in another universe that we have a little bit different way to manage the data and to monitor that. And now with more technology, they still can make it available for its good purpose. In the meantime, because it's consent only, it can still provide individually our data, our privacy for the patients, individuals. So let's come back to my country. I have to say, we have recently launched too many new policies, and I'm not going to go through all of them, but I listed here so that later you can read them on your own. Basically, we have this Hainan province, which is very close to Taiwan and Hong Kong in the south. It is a big island, and now they made it called real world data application pilot. This is pretty new, just happening right before COVID happened. Because in one zone, they now do everything there. And there, they also established many other new regulations. Look, here we have now established 12 real-world research guidance principles, and it's already considered internationally leading in its competencies. On the other hand, in this, we integrate everything. All this system, all this data can be traced. Everything can be shared just within this closed loop that you can do different trials and you can do different things all there. And that's why last year they issued this first, they call this free medical real world data management regulation. Basically, it's combining your healthcare, your medical insurance, and the pharmaceuticals, risk systems all together, so that with this real data, it can support future drug evaluation and pricing decisions. And that is what they are doing. I think this China is so huge. Obviously, we cannot say, and when I said earlier, we are not Japan, Korea, or Singapore. But still, sometimes in a huge market like mine, from region to region, the difference can be so huge that it's probably necessary to have a also innovative way to consider. We have a different methodology to be innovative, that this kind of pilot is still necessary instead of just roll out a nationwide regulation. So this is for your consideration. And we have some data here, this pilot zone. Obviously, we cannot deny we had 3 difficult years of COVID influence. But as of this year, April, these are the data we have. And we already have some foreign drugs just to be approved there. And I'm taking advantage of this region that they can do many things much faster track and also can be in one pilot zone doing everything in the closed loop. We also wanted to let you know, this is a nice photo of this region so that you get an idea. One day can go visit and I'd be happy to take you there. On the other hand, let me say we have certain policies and many speakers already mentioned them. Money is the problem, funding is the problem. and which is true. China has recently taken this. I'm sorry, I'm taking my own alarm as well. I'm aware of my time. The
No,
tech
thank you.
finance, basically, we are talking about um, the government. On the one hand, we also have some public fund, but we also make it a very specific use, meaning nowadays with AI, with different technology, when it comes to how to use this money, how to take the fund to the right places, we obviously have a preference that in the health sector, it has to be very tech oriented. If it has very advanced medicine or tech advancement, and that is where the money goes. On the other hand, the government is giving credit to different small BMACs here, the small SMEs, when it is necessary, depending on the different need. And just 5 days ago, the 1st of May this year, we rolled out a new policy, and let's take a look. I highlighted some of them, and I promise you I will give you these slides, but basically, let's just have a glance. It has very specifically have a new translational pathway. I think it probably we can get some idea because we're talking about ATMP, no? And how it is now defining very clear criteria. And not to mention, we still want to ensure data integrity. Even though, yes, people, we always say China, we have probably no privacy and blah, blah, blah. But at least, let's say from the government point of view, they are serious. They make it very clear that data fabrication is strictly prohibited and it will be subject to criminal liability. And also we have AI drug regulation initiatives. And we put here in euros, it would be probably a bit like 11 billions in terms of how we are going to put further funding in this field. And look here, we have this criteria, including all these different, very clear direction, which fields gene therapy, cell therapy, and brain-computer interface, all these new areas will definitely get a priority. So this is pretty just coming out of the government just 5 days ago. I really want to share with you so that you can get an idea. Action is also another topic because right now, just last year, China rolled out this because we have this Healthy China 2030, like your Horizon Europe plan. And they started to have this K visa. Basically, it is for young researchers, especially in the STEM fields. And this is very eager. Remember, we said this project earlier regarding the hospital clinic. We are nowadays, yes, number 2 in terms of GPT, but China, historically speaking, in terms of software, we have a long way to go. We might have the funding, we might have the system, the wish from the government to push to do things, but we still need Europe. And that's why I think this is the point that we should collaborate more. Here I put these 4 countries very briefly, some cases, some practice what they are doing. Hopefully it can inspire Europe in your case, like implementation, how we can really do this architecture to make it actionable. Because we all know it connects evidence to decisions and not just to make a plan. We need to actually make it working in implementation. So I cannot stress this more, probably because I'm from the business world. Communication, 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 and collaboration. Europe is strong. There is no doubt about it. We have big respect from China to you guys, but also we have nowadays our advantages. That is, we are quick. We are probably integrating data better, and we probably do many things very much integrated and can make things happen. However, we do need each other. So who knows, maybe in the future, we can probably do trials together. We probably can do joint RWE standards or parallel HTA. Why not? I'm just thinking we should really, when we talk about innovation, our mind should be innovative as well, should be open, really, how we can really, these 2 worlds can do things together. Obviously, we know we have our limits, we have our concerns, we have different systems, and we have our consideration, but I'm sure there are different ways. I just want to mention lastly, quick about, because earlier the BioCat mentioned that they are in that ecosystem, the DTI Donation and the Transplantation Institute in Catalonia, which I'm also in touch with them. They have been working almost more than 10 years with China. And you know what? The whole organ donation and transplantation system in China was basically trained by people from here. For 10 years, the past 10 years, I have been going to China, training them to do the whole system. They have huge respect to you. And that's something I think why not we can take inspiration, take what China can offer, Asia can offer, and we can do things together. And this is sincerely my wish, and hopefully this can be something not just to learn from China or Asia, but we can really do things together. Thank you very much.
Thank you, Taowen.